Bueno, buenos días a todas y todos.
Good morning, one and all. It is a pleasure to be here with us and welcome to the webinar Getting Old in Latin America and the Caribbean, Social Protection and Quality of Life in Older Persons, organized by the Inter-American Development Bank. This will be a conversation in Spanish, but for those of you who wish interpretation into English or Portuguese, you will find an icon in the bottom of your screens which says interpretation, and you can select the language of your choice. I am Maite Sanchez. I will be moderating this webinar. And for starters, I would like to introduce Ferdinando Regalia, manager of the social sector, who will give us some welcome words. Good morning, one and all. There is a time in our lives when we start to ask ourselves, what will be my situation in 20 or 30 years? Will I have a pension? Will I have sufficient savings to retire? Will I have good health services? Will I require help in my daily life? Those questions are questions that many people in Latin America and the Caribbean ask themselves because our region is aging at an unprecedented rhythm. We live more, which is good news. We now have challenges to make sure that we live well. We have to jointly think about issues such as pension, health, and care. It is a fascinating area, so I will leave you in the hands of our experts and our moderator, Maite Sancho. Maite is a psychologist and gerontologist, and she participated in the process of elaboration of the law of promotion of personal autonomy and attention to the situation of dependence in Spain. Recently, she was selected by the United Nations as one of the 50 more important leaders and influencers in aging healthy. Today, we are very lucky to have her with us. A hug and all the best to all of you. Thank you so much for this very nice presentation. It is really a true pleasure to be able to moderate this webinar today. We have the honor of having some of the authors of the publication, Aging in Latin America and the Caribbean, Social Protection and Quality of Life for Older Persons, such as Pablo Ibarran from the IDB, Marco Stampini, leader specialist in social protection, and Laura Goyeneche, also author of this inform. Before giving the floor to Pablo, I will mention some logistics issues. We will have 25 minutes of presentation followed by the Q&A session. We invite you to ask your questions in English or Spanish by using the question and answer button in the Zoom. We shall select some of those questions and they shall be directed to our presenters at the end of the presentation. Your microphones and your cameras have been turned off. Pablo, I give you the floor. Thank you so much, Maite. It is a pleasure to share the webinar today. And from the bank and from the region, we're happy to have your cooperation. Congratulations on the recognition of your lovely work. Thank you so much for being with us. Before Laura and Marco go into more detail about what will imply the aging of the population for the health and care systems, I will present the framework and the 5 main messages of the report. Here we analyze the quality of life of older persons, how it is related to social protection measures, and how these policies need to adapt to the aging of the population. We consider that the quality of life of older persons is a combination of their health and their safety as far as their income. So we created an index which measures how many years can a person of 60 years, 5 years of age or more can hope to live with good health and without poverty. There are many other elements that can influence on their life quality, but this is a simplification which allows us to go forward with a study. We define the social protection for the elderly, such as the policies for pensions, health, and long-term care. These 3 policies are very much linked to the quality of life of the elderly. Pensions reduce poverty. Health services not only improve the health of the population, but they also contribute to reduce poverty since they decrease the risk of having to incur in catastrophic expenses. And finally, they increase the well-being of people who require support, but also of their caretakers. In the report, to analyze the situation of the policies in our region, we have created an index for each one of these three dimensions, which include coverage and quality of life. And we classified each dimension in four categories: very low, low, high, and very high. Then we created a global index, which you can see in the publication. And you will be able to see that the work presented in this report includes pensions, health, and attention to dependence. In today's webinar, we will speak about the two latter ones. And now we will speak about the five messages. The first message of the report is good news. There has been a substantial increase in the quality of life of older people over the last 20 years. Whereas in 2000, a 65-year-old could expect to live an additional 7.1 years in good health and free of poverty, in 2019, this number increased by almost 40%, reaching 9.7 years. Most of this increase is due to an improvement in the income security of the elderly, and not so much to improvements in health. In the following graph, we shall see that although this progress is important, there are important inequalities for gender-based in each country. And these gaps have been narrowing, but women have a worse quality of life than men. This is because, although they generally have a longer, healthy life expectancy, they are more likely to be in situations of poverty when they are older than 65 years of age. This regional trend, which we have seen about an improvement in the indicator, hides important differences between countries. We know that Latin America and the Caribbean is the region where there are the highest number of inequalities, whereas Panama, Chile, Uruguay, and Brazil, a 65-year-old can expect to live in good health and out of poverty for 12 additional years. In countries such as Guatemala or Honduras, the figure is only 5 years. The second message that we want to transmit is despite progress, there are great challenges to improve the coverage, quality, and sustainability of social protection policies that support the quality of life of the elderly. We conclude that while coverage of health services is high in most countries, there are barriers to effective access, and the quality of services is generally low. Long-term care systems are practically non-existent, and when, therefore their coverage is low and the quality of services is low as well. The third message is that we think that policies matter. In this graph, you're looking at shows that the correlation between the quality of life index for the elderly and the index that combines coverage and quality of social protection policies. As you can see on the graph, countries with better scores on social protection index also score better on quality of life index. Our estimates show that in countries with good social protection systems, older people live 6 years longer in good health and out of poverty relative to countries with low levels of protection. The fourth message is that due to population aging, social protection policies for the elderly will still face major sustainability challenges, both fiscal and social. We estimate that the total spending on pensions, health services for the elderly, and care services, assuming that the latter expand, may increase from 7% of GDP, which is the value we have today, to 14% in 2050. Roughly half of the increase is due to pensions, while the other half is due to increased spending on health and long-term care. If current trends continue, some countries in the region are on track to surpass the levels of expenditure that OECD countries have as their populations age. But, and this is an important difference, with services that are characterized by lower levels of coverage and quality. The last major message we want to give you is that the region needs to adapt its social protection policies for the elderly to meet the challenge of population aging. As Ferdinando mentioned in his opening remarks, in order to increase the coverage and quality of social protection while containing the increase in costs, it is necessary to adopt a holistic and integrated approach among the different areas of social protection to take advantage of the synergies and complementarities among them. And this is precisely the focus of the report, to have a holistic approach to social protection policies, their interrelationships, and how they can improve the quality of life. I'm going to pass the floor now to my colleague Laura Goyeneche, another of the authors of the report, to focus on health systems. Please go ahead. Thank you, Paulo. Good health is essential for a good quality of life. People value health as an end in itself and as an important element of a good quality of life. As Ferdinando and Pablo were saying, that older people in the region are living longer than ever before, but this does not necessarily mean that the additional years are lived in optimal health. As the graph shows, the good health of 65-year-olds or older in the region continues to lag behind of people living in wealthier countries. For instance, in OECD countries, people at age 65 can expect to live 15 years in good health, which could be 4 years more than what occurs in countries such as Bolivia, Guyana, and Haiti. And while the region has reduced the prevalence of many diseases, the prevalence of non-communicable diseases such as diabetes, cancer, and hypertension offset these gains, especially among older people and older people of lower socioeconomic levels. Next slide, please. We know that the majority of people in the region have high access to health services according to the coverage index, essential services coverage index of the WHO. Most countries in the region have high coverage of essential services. Even according to data available for some countries in the region, a high percentage of people aged 50 and over receive access to treatment for hypertension or diabetes once they have been diagnosed with a disease. And this achievement is the result of years of efforts by all countries in the region. Despite these advances, evidence indicates that many people in the region still face significant barriers to formal coverage. These barriers include the coverage and access to health services when needed. For instance, here we show some of the barriers: distance to health facilities, waiting times, cultural barriers, lack of drugs or staff at the facilities, or inability to afford the out-of-pocket cost of services or drugs. And there has been an a considerable increase in the out-of-pocket expenses. These expenses can, in some cases, reach catastrophic proportions, increasing the risk of falling into poverty. In addition to problems of access, there is also the low quality of services, particularly for the management of chronic disease. In fact, it is estimated that 70% of deaths in the region can be attributed to poor quality, including unqualified staff, inadequate facilities, or poor management of chronic diseases, not a lack of access. In this graph, we see how the region ranks relatively low in the quality index developed by the IHMF compared to OECD countries. Also, in the case of coverages, we can see that there is great heterogeneity that exists among the countries in the region. It is also important to point out that this situation is even more critical in the case of the elderly, as the region's health systems are just beginning to adapt to the epidemiological change caused by population aging. And finally, next slide, please. We want to say that reforms to improve the coverage and quality of health services must take into account their sustainability. In total, healthcare spending is expected to be higher per person or per capita is increasing with age. It is expected that in 2050, healthcare spending is going to be 175% higher, and the aging of the population is to account for 37% of the increase in spending in 2050. If nothing is done, health spending for the elderly is projected to increase from 2.2% of GDP in 2020 to 4.8% in 2050. And this projected increase in spending will be due from the population which is 65 years of age or older, since the expenses for younger people will remain the same. I will now turn the floor over to Marcos Stampini, a specialist in social protection and health at the IDB, and another of the authors of the report, to comment on the development of care systems in the region and end with some thoughts on the way forward. Thank you, Laura. Today, in Latin America and the Caribbean, we estimate that there are 80 million people over the age of 65 who need help with basic activities of daily living. In other words, they need long-term care services. This figure sounds a little bit cold, 8 million, but these are histories or stories of the elderly and their families. And I would like to give you an example from my family. In December last year, my father, who's 89 years old, had a stroke, and we were told that it was possible that he would stay in bed for the rest of his life. We had to face very difficult issues. Could he stay and live at home? Which adaptations would be necessary? Which services could he receive? Who can help me find out which services he requires? And we, the children, can we continue working, or we will have to take time out of work to help him? I am certain that in many of your families you have had similar situations to this one. So of these 8 million people, these are 8 million family stories which are similar to this one. And due to demographic trends alone, this figure could triple by 2050 in the region. And by then, older people will be us. The countries in the region started to build care systems in their policies. But as we will see, services in the region are still characterized by low levels of coverage and quality. Starting with coverage, what is it? It is the percentage of people who are elderly or dependent who receive care as a percentage of those who require it. 4 countries in the region, which are shown at the top of the slide, have coverage levels which we classify as high, above 15%. In no case the coverage exceeds 20%. Then we have 3 countries which show coverage that we qualify as low, which rates ranging from 6% to 11%. And in the remaining 19 countries analyzed, the levels of coverage are very low, below 5%. So only 1 out of 20 people who require services receives it. And what is more complicated is quality. In order to measure this dimension, we considered factors such as quality standards, the existence of institutions and mechanisms which look at the compliance with these standards, the level of compliance with these standards, and compulsory requirements for the training of human resources. If we look at this slide, we see that the first 5 countries are classified as a low quality, and the remaining 21, the quality is very low. Just to name one example, only 3 countries in the region have mandatory requirements in terms of human resources accreditation: Chile, Argentina, and Uruguay. And the issue of quality is very complex. Think at the enormous unsatisfied needs for the caretakers who work in homes. Sometimes there are professionals who are remunerated. Sometimes they are remunerated with a different country. For instance, they are considered like house help. And also the importance of training those who take care of families, which provide the majority of services in the region. The issue of sustainability was analyzed considering 2 dimensions, the financial one and the social one. The region does not have a fiscal or financial sustainability issue for care systems, since these systems are just being created now. We know that if the countries in the region want to have systems that give a coverage of about 50%, with adequate levels of quality, this could cost by 2050 about 1.4% of GDP. What we do know is that if countries do not create these care systems, they will face a sustainability. They will face a social sustainability issue, because if there are no services financed by the state, the majority of the burden of the care will be with the families, and within the families on women, with negative consequences on their quality of life, on their participation to the labor force, and their career progression. That is to say, in the region, building care systems is a fundamental step for the agenda of gender equality. If we look at the analysis which is presented in the report with regard to pensions, health, and long-term care systems, it would seem unavoidable that countries in the region need to implement reforms. Some of them are specific for these sectors. For instance, in the health care, there is a need to increase the focus on primary health care and on prevention and management for a healthy aging. In long-term care, it will be fundamental to start with the training of human resources and training of caretakers, because the quality of human resources is the pillar of the care system. But the main fundamental issue that we point out in this report is that countries will have to adopt systemic reforms, and the reforms of pension, health, and care will need to be designed, implemented, and designed together. To give another example, it will be necessary to integrate the healthcare system with long-term care systems in order to have efficient systems in both cases. For instance, by reducing the time that elderly spend in hospitals, who stay in hospitals for many days because they cannot receive rehab or care services outside the hospital. It will also be important to adopt integrated reforms. It is easier that a pension reform should be socially acceptable if it is taken with measures that improve the quantity and quality of health services and attention to dependency. It will also be necessary to articulate this with the private sector, which offers an important part of care services at this time. And this can generate entrepreneur opportunities and create jobs in the economic system. Fortunately, we start seeing examples of these reforms with an integrated vision in the countries of the region. If you would like to find out more about the challenges facing the countries in the region and the reforms that you will need to implement, we invite you to look at our report with the link that we are now showing on the screen. Thank you so much. Thank you so much to the three of you. I believe that the presentations are just a small sample of the quality and rigor of the report that we are introducing today. The invitation for me to make a final comment is difficult because truly I believe that a lot of important things have been said, and in any case, I would like to share with you some four basic ideas which could be included in the conceptual framework of what has been said today. We have spoken about heterogeneity, and I believe that it is a key issue, but not only amongst countries and systems, but also heterogeneity amongst people, because getting closer to care has to take into account the fact that people are different. So this is an issue which has to be taken into account today in order to try to adapt care to the wishes and preferences of people and to their needs as well. We have also spoken about prevention, and I invite you to go one step further. Prevention is highly related to health prevention, but there are other types of preventions which I call take decisions on time. That is to say, think about my life in the close decisions on the future, decide how we're going to live when we grow older. And for this, we need to face the fact of aging. This is not something that pleases us a lot, and it is not an issue that we do not like to talk about, but it is important to think that we will age and therefore we have to make decisions on how we are going to live. This is fundamental. The other one is cross-cutting. In addition to health systems, care systems, and obviously the pension system, there are other issues which need to be present when we think about planning about care. For instance, the homes. The homes are essential when we think about care, and especially taking into account what people wish to do. Some people wish to stay in their homes regardless of what happens there and how easy that is. But as you know, sometimes this is not possible. So the homes and accessibility to spaces, all these issues, as well as friendly spaces, are essential for a design of a new system.
And the coordination, well, yes, coordination between health and social services, a lot of attention from health to advance along that pathway. And that has very good effects because it is our reality. Fortunately, when countries develop more, then time in hospitals and the use of medical services is lower, and we have a good system in cares and regulation. We also have a social protection system that is more cost effective because generally health expenditures go down normally. I could go into further details, but I believe that this is very important. And finally, a comment on gender. I think that to speak about aging and gender is to talk about women, all the protagonists, from women, professionals, wives, daughters, that make up the family group. And of course, this is at the moment a situation of discrimination. I would say that it is almost scandalous throughout the world because cares still have very little social value. Health, not health, but care. And I think that it is the work that is less valued socially, less with the lowest payment, not attractive at all, and which men access as the last resort. I think that this is essential for us to take it as an extremely important challenge for the future, that I think it is going to improve the quality of our lives. There are many things, but all I can do is congratulate you for the excellent work that you have done. So now we will go into the questions. I see that there are many questions, too many for the little time that we have. But well, I see that a person named Christina is addressing Marco or Pablo for the following question. We know that most of care responsibilities lie on the women of the homes. How can men contribute to close these gender gaps, also ensuring the quality and education of human resources? Comments? Perfect. Thank you, Maite. If you'd like, I'll take this question and I'll leave the next one for Marco. I think that the key here in several of the care systems, when they are being created, they bear in mind this enormous burden that healthcare implies for women. And first of all, we have to reduce that burden that will fall on her and the family. And maybe if access could be achieved to healthcare systems, that burden will be lower because there will be support through personal assistance that will support in the care in the home. That's the first step. The second very important step is to distribute this work, this care work. We have to be clear that it is not a responsibility specifically of women, and it should be assumed equally among men and women. And this implies an important cultural change, and that in several countries of the region has been significantly emphasized in a broader agenda. But it is a very specific way to land this idea of equality, what it's about, and the care of the elderly, and especially household tasks, should be assumed equally between men and women. And there are regulations, institutional regulations that can help in this. The third thing that was mentioned also in the same question is to professionalize and value care work. As you said, it is not valued sufficiently, and we have to invest in the training of the individuals that are in charge of this, and for them to receive a salary and for them to have access to training, to education, so that they could develop these tasks better. And also to be able to carry that burden that this implies in emotional terms and in terms of their own health, and caretakers for them to take care of themselves. And with these three elements, I think that we can advance, we could move forward towards closing and correcting these gender inequalities that we see today. Thank you very much. Okay, thank you. We now have a question by Robinson Cuadros that asks, what steps should the countries of the region take to make up this or to integrate care and health? Is there an integration in the region between these two? Who would like to answer? Okay, I'll take the question. From a more general point of view, not in relation to one of the countries of the region, I think that a professional figure is fundamental when a home, when a house has to provide care services for a senior person. This is not necessarily a professional from the health or the social sectors. A multidisciplinary team should work on this, but families in many cases are left alone and they do not know how to develop a care plan. This can be articulated between services of the health sector and the social sectors, integrated also with systems or the work of this professional figure with systems, with reference systems and counter reference, so that a person can, for example, right after a fall, go to the hospital, follow rehabilitation, and then if there's communication, communicate or contact other services and see what cares the person is receiving. There's also another scheme, a financing scheme that can provide this articulation to avoid a type of service to have a financial incentive and well, maybe this could be left in hands of a single person. Very well, thank you very much.
¿Está bien?
Is that okay? No, I was mentioning that there are countries where the state provides financial subsidy, but not of free use. I think that I'm having problems with my connection. It's unstable right now. I apologize. But this state subsidy is managed for the purchase of services in the public-private sector with the help of this case manager. Thank you. The next question is for Laura, and it asks, what are some of the strategies to address the coverage and accessibility challenges for the service of the elderly? It's hard. Well, beyond the reforms that Marco mentioned and summarizing the general points of the presentation, where we have to adapt health systems to the new epidemiological profile, giving it a comprehensive approach accompanied by measures that guarantee healthy aging. I would like to mention something that I did not mention in the presentation, but that is important to acknowledge the differences of gender in the design and implementation of health strategies and reforms. And the data and the health data analysis, what we saw, for example, is that women are more affected by mental disabilities, and they are very weakening and generate many disabilities. So these mental disorders have to be considered for populational development. And then in 2019, for each 100 people over 65 years of age, mental disorders were responsible of 14 years that were lived with a disability. And this number becomes even more impressive when we compare it, for example, to diabetes. It represents twice as much as the disability that is generated for people with diabetes and almost 3 times more for people with neoplasia. So I think that we have, beyond what has been named in the reform, it's important to recognize these gender differences to be able to address them adequately.
Muchas gracias, Laura.
Thank you very much, Laura. Now, Marco Pablo again. Carolina is asking, how do public health systems operate in practice? What services do they provide? If you'd like, I can add a bit more because we have many questions. The next one is also addressed to you. How can we measure the quality of services, attention to dependency, or how should a quality system be? What should it be like to be efficient? Okay, thank you very much, Maite. This is a very good question because it allows us to understand how a care system could be visualized, could be seen. A person that has a level of dependency functional that requires support for daily activities can access the system and can do it in a way that the person actively seeks out for the service, or maybe through quality primary attention that will in which this need will be identified and can be referred to another area so that, for example, we can determine what type of dependency the person has, what types of services the person requires, and then access the system. Now, what services does a care system provide? One thing is what we observe in Latin America and what is observed in other countries and what would be ideal. There are a series of services. What you mentioned at the beginning, what people want to do or are seeking is to age with dignity. So they want support in their homes where services of different intensity can be provided depending on what the support need that the person has is. There are also services such as day centers where people can remain for a few hours a day and where there are also rehabilitation and support activities to their situation of dependency. These are not the social centers that have other responsibilities. And with a higher level of dependency or less access to other supports, there are long stay homes because, well, as I've said, people prefer to live at their own homes. Then cross-cutting aspects, we have the use of technology to favor the fact of having people stay in their homes and have quick access to social support and health support systems. So I think that the idea in several countries of the region are starting to apply these systems, for example, in Uruguay and Argentina, where there is an effort and an exercise of integration services for health and social aspects. But the idea here is to measure quality because we know, for example, in child development, how important it is to measure quality when we provide the services. In Latin America, and as Marco explained, the quality, the way we measure it is if there are standards and the standards are applied. And it's also important to see what the interactions are, how the person is carrying out the day-to-day, the person that requires support either at home or at a center. And obviously the attention service at home and to monitor its quality is very, very complicated because there is no access there. So several tools have been developed even with technology to try to have a series of criterions and to be able to observe this both by the service provider as well as by the family. And this is an important challenge. We start from the need to have human resources with sufficient levels of training so that they can have the necessary elements. And then how to achieve on-site verification. This is definitely a challenge. Thank you. Maybe if I could add to quality, I wanted to highlight that there are many elements in the development of a care system, for example, financing, but also if there is no funding source for the system, there are services that operate in the countries, and these services need to be regulated in their quality. When COVID arrived, we saw that many of the residencies of the elderly did not have any connection to health services. And we didn't know where the people were living. So quality is already present, regardless of the level of development that public services have in their countries. But that should be the starting point, and this is closely linked to training of human resources.
Bueno, muchas gracias. Continúa
Okay, thank you very much. We will continue with many more questions. And once again,
Marco, Pablo,
Marco, Pablo, you are required. Technology. How can technology improve the condition of the elderly, their care and attention? Do you know cases of use? Well, going back to what was mentioned on the quality of the attention at home. For example, last year, the bank through IDB Lab, which is the part of the bank that supports innovative initiatives, has launched a call for silver economy. And this had to do with care, with household or care at home. And we've seen initiatives with technology that allows to first connect people that have a dependency in their homes to different services in teleassistance, telemedicine, and these platforms can provide training to the people, to family caretakers, people at home, or also paid individuals that work in these homes. And aside from the training, this is also a way of registering the types of services that are being provided. It's not just a matter of observing the system, but to see if a certain level of attention has been provided, what vital signs the person has at the moment. And this is also linked to telemedicine because it also allows us to foresee cases of a worsening of the person's health and to act in a preventive way.
Ok. Me parece que hay una
Okay, I think that there
intervención,
is
digamos, que tiene alguna categoría
a
especial.
presentation, aside from having a
En
special
primer
category
grupo corresponde a don Enrique Iglesias,
that
que fue
corresponds to Mr. Enrique
directivo del
Iglesias,
Banco Interamericano de Desarrollo,
closely
fue
related to the
presidente
IDB,
del banco durante muchísimos años y ahora
president of the
líder
bank
de
for many
una
years,
fundación
and now leader
extraordinaria que
of an
además nos
extraordinary
une
foundation that
a
also
España y Asturias, mi tierra,
links
con
us to Spain and
Uruguay. Tiene
Asturias,
la
my
palabra, don
land,
Enrique.
with Uruguay. You have the floor, Mr. Enrique. Thank you very much, Maite. Well, first, I want to congratulate you for being part of the history of the institution. That is how the bank started in the 60s. Out of the normal tradition of a bank. The second is that I think that what you're doing in this field is beautiful. And I'm sorry, the gentleman's audio is very difficult to understand. But we have joined a country that has always placed a lot of interest on matters and issues of the elderly, particularly in recent years. This protection system of the elderly has grown significantly. And there's a central matter that it will become acute and will be more and more present. And the important thing is to address this, not only as a problem or an issue, but also as an opportunity. The idea is to take the elderly as a comprehensive part of society that are moving towards better futures. And we accompanied a government that took this as a central matter. Uruguay has an old tradition, but aside from that, during the past 20-25 years, special attention has been placed on the care system, the general care system. And I see from your questions that you're tackling the main issue, and that's the way it should be. And we will reach 25% coverage in our country. And we're working on reaching these goals. So in all of that, the matter of looking at this as an opportunity, I think that it is a very good thing. I like the comments on care. We began the foundation with this topic focused on care in a country that already publicly has a care project underway. Then, as to the relationships among the elderly, the physical space, the unwanted loneliness, which is a fundamental matter in all these fields of analysis in countries such as Japan and others. I think that somehow all of this this is a very rich topic. And the important thing is for our elderly to feel part of society and not feel left aside or left out. So I want to congratulate you for this. We've worked on something that is wonderful thanks to the support of the IDB. And this is very important in the lives of people and also in the way of relating our seniors with our youngsters. This is very important and allows to have social balance. But in any case, I just wanted to say that this is wonderful work. I congratulate you for focusing on this that you're bringing to the table, because you're taking advantage of this topic, and I wish you much success and thank you very much. I congratulate you. Thank you very much. I don't know if Pablo, Laura, or Marco would like to add anything. Any final comments? Okay, yes, thank you very much, President Iglesias. It's a pleasure to have you here. And I think, yes, indeed, the focus that we want is that we have great challenges, but it's also a great opportunity. And first of all, it's very good news, as we said, that societies have managed to have people live longer with better health. However, there are challenges that are natural, which is natural, but the idea is to be able to recognize them and face them. I think that this is something that is very important. Sometimes when we talk about the demographic tsunami, I say that that's a terrible example. It's actually an enormous opportunity that we have. I also underscore the role that they have, and Marco talked about the opportunity for the private sector, but the role of civil society to learn from local experiences, as is the case of the foundation that was mentioned. And then in Latin America, and when we look at the experience of national care experiences, there are not many, but when we look at the initiatives, there are many, many local initiatives from different stakeholders, and it's important to grow there. And the third thing that you highlighted is loneliness, to think not only, or solitude, to think not only of the physical state of people, but their integral, their comprehensive state, so that they can continue to contribute to society. So I think that these are very important matters. And obviously, I thank you very much for your comments. And it's a pleasure to continue in the bank to work on these things and to still have your participation. Thank you very much. Thank you very much. Well, I'd love to continue discussing these things, but it's not my call. Francisco, you're asking me, but we'll leave this for later. Diego, given the importance of care systems and the investment that this implies, what strategy do you recommend so that the ministries of finances can guarantee budget for the operation of these systems and for them to be sustainable? I think, who dares to answer that? I do. Because there are two recommendations. One, to start small and to grow progressively. Care services, as was mentioned before, already exist. They exist in the private sector, they exist in municipalities. So we have to start there by organizing what already exists and grow progressively. And when we talk about ensuring the funds for the future, we have to adopt a comprehensive view, not only spending in health sector, but in pensions for the elderly, in health and care services. We propose a vision that needs to look at what is being done in the three sectors to offer service packages that include the three social protection areas. And from there, find a way to finance this. And that will be equal for everyone. Okay, thank you very much. I'm going to read a question that is addressed to me, and I'm going to answer it very quickly. Francesco asks, how can the elderly assume an active role in the construction of a positive conception of care and for them to recognize their role within society, and how to involve the other groups in a co-responsible way? I think that we're already there. There is awareness in society, among other things, because we are many. But aside from that fact, those that are coming, those that are now being a part of that senior society, we are doing this with greater education, with more purchasing power, and with more autonomy. I think that we are more demanding generations in the good sense of the word, so that our voice can be present always. And well, since this phrase has been generalized, nothing for us without us. So therefore, I think that that is a clear answer, and I can assure you that this is being carried out now in many places with difficulties and fighting against stereotypes that harm any group of the population so much, in this case, the elderly, because it definitely generates discrimination. But we're working on this and we're going to achieve it. I can also say that we've learned from other movements, such as the Me Too movement of women. And maybe we as seniors also have to participate and be present where we should be. And well, I think that we will we will ask one last question because we've run out of time. In your opinion, what are the essential elements in the development of an attention system to the dependency, and also a comment on the relationship with the private sector and business and job opportunities? We have 2 minutes.
Bueno, abro el micrófono porque no
Okay,
sabía si Pablo.
I'll take the floor. I didn't know if Pablo wanted to answer this. Training of human resources. First, regulation of quality and planning of financing of services to expand coverage, starting small. We had a publication a few years ago that is called To Age with Care that was focused on 5 basic principles to start. So with this publication and the report that we're launching today, we have set forth a pathway for these care systems. We also have a work program in parallel that talks about the active role of the elderly: education, entrepreneurship, involvement, social involvement, etc. And there, we also have the part of the opportunities of entrepreneurship and of the goods and services for the elderly. I know that we do not have more time, so I'll stop here, Maite, so that you can close. But this is a very long discussion that we can have on another occasion. Thank you. Okay, thank you very much to everyone for your presence, for the quality of the presentations, for the comments by Dr. Iglesias, and for the warmth of this hour that we have, I think, all enjoyed. I must insist that you can download this report that is in Spanish and English with a QR that appears on the screen. And you will immediately be able to access this recording. And to the 70 or 75 people that have not received an answer to their question, I offer to answer at least some of them. And I'm sure that Laura, Marco, and Pablo will be glad to answer them also. Once again, thank you very much. Have a wonderful day. And well, for the little bit of the day that is left for me, because it's late here, I say goodbye with a warm hug. Thank you. Thank you, Maiten. Thank you, President Iglesias. Thank you. Thank you very much.